Hi everyone, I am Beatrice. In today's topic, we'll look at standard and isolation precaution. This is a topic that is commonly asked in NCLEX, but it can be a bit confusing. I have an acronym for each of them to help you remember in your exam. I have also created a PDF of NCLEX style question on this topic. I'll leave the link in the description. So let's begin. First, we'll look at standard precaution. So when we say standard precaution, we're just talking about the precaution we use for all patients. It's just standard, the normal thing we do. So the way the standard precaution works is for every patient you come in contact with, you want to protect them, and at the same time you want to protect yourself. Now for the use, we use it for all patients. For any body fluids, any contact with skin, especially non-enter skin, maybe a patient has a wound or cut. We also use it for mucous membranes. The things we do in standard precaution include hand hygiene, we wear gloves, we wear gown, mask, eye protection, depending on the situation. Let's say you are caring for a patient and there's going to be a risk for splash, or contact with body fluid. You want to be using eye protection, you want to use mask, you want to wear gown, gloves, and also part of standard precaution includes safe injection practices. Proper disposal of injection, handling injection properly. Also, proper handling of soiled linen to prevent infection and contamination. Now we look at isolation or transmission-based precaution. So this one is specific to a particular disease process, and we use it at times in addition to standard precaution. So under this, we have contact precaution, droplet, and airborne precautions. First, we have contact precautions. So this one we use it for infection spread by contacts, either by body contact directly or indirectly. What we need for contact precaution include nursing the patient in a private room or cohort. So for cohort, we mean if we have two patients that are to be nursed in the same room, if they are having the same organism, the causative organism is the same, they can be nursed together. And then you need a gown and gloves. In addition to the use of gown and gloves and nursing the patient in a private room, you have to perform hand hygiene. If your hand is not visibly soiled, you can use alcohol-based hand sanitizer. But if your hand is visibly soiled, you have to wash your hand with soap and water first. And also, very important, if the patient is having C. diff, you have to wash your hand with soap and water. I have stated this is very important. And also, you need dedicated equipment like stethoscope, even BP cuff for each patient should not be shared. Now, examples of contact precaution. I use an acronym, Mrs. We. So this stands for, the M stands for MRSA, the R stands for RSV, the S is for skin infection, any of those skin infections, and then the W is for wound infection. Patient have wound, most like open, you have to use contact precaution. Enteric infection, this is where CD falling, and then eye infection like conjunctivitis. If you are finding value in this video, please hit the subscribe button and leave your comments. The second one is droplet precaution. So this is the precaution we use for infection that are spread through large droplet, like through sneezing, coughing. So for droplet precaution, you have to nurse the patient in a private room or also cohort, like in contact. You need a mask. So this is unique. You don't need a gown for droplet, except the patient has something, maybe there's something on the skin or anything that has to do with bodily fluid. But if it's just for droplet precaution, for the sake of exam, is mask the patient needs in a private room or cohort. Also, concerning the mask, you as the nurse will be putting on the mask in case the patient needs to be transported to another location for one procedure or the other. The patient will also need to wear a mask. And the mask we're talking about here is just a regular mask. Examples of droplet precaution. I use an acronym Spider-Man to help you remember. So the S is for sepsis, P for pneumonia or pertussis. Pertussis means whooping cough. I is for influenza, D for diphtheria, E is for epiglottitis, R for rubella. Don't confuse rubella with rubeola, which is measles. That will be under airborne precaution. We'll look at it shortly. M for mumps and also meningitis. A for adenovirus. And then N is for Neisseria meningitidis. Finally, airborne precaution. Now, for airborne precaution, we use this for any infection that is spread through small droplets, like as seen in measles, tuberculosis. Now, the patient needs to be nursed in a negative pressure room. Patient will not share the room with anybody, so you don't cohort. And then the nurse will need an N95 mask. Example of airborne precaution, I use an acronym NTVST. So NTV, like MTV in the air, right? So MTV, M for measles, where we have rubiola. Then T for tuberculosis, V is for varicella, S for SARS, and C for COVID, like COVID-19. Now, there's something I want to throw in concerning varicella, which is chickenpox. Now, there's what we call shingles or herpes zoster. Now, if it is disseminated, the shingles is disseminated, it has spread to every other part of the body. It's not just located in one region. You have to put it under airborne precaution. But if the shingles is localized, it will be under contact precaution. So that wraps up today's topic on standard and isolation precaution. If you find this video helpful, please like, share this video to every other person that needs it. Subscribe to this video and leave your comments. Thanks for watching.